Hi guys, what's up? So we are live again and let's wait for this live session, this session to go live. Hmm. Hello, hi guys. Yes, I think we are live now. CNS complete नहीं हुआ but ये वाली हमारी क्लास जो थी शेड्यूल्ड थी, so uh, that's why we are taking this session. I'm sorry, I'm really sorry. CNS वाला जो टॉपिक था CNS वाला जो टॉपिक था इट इज नॉट completed टिल नाउ. अपने आप ही कुछ एरर्स की वजह से लैपटॉप बंद हो गया था. वाईफाई वाज ओके, एवरीथिंग वाज ओके, बट आई डोंट नो व्हाट हैपेंड टू हिम. तो CNS वाला टॉपिक आज 9 बजे हम कैरी ऑन कर लेंगे, राइट? तो हमारा लगभग 40% कवर हो गया था सम अप सेशन में. एक सम अप सेशन 2 होगा शायद आज 9 बजे हो सकता है, बट लेट्स सी व्हाट हैपेंस. अभी तक शेड्यूल नहीं हुई और MCQ वाली क्लास शेड्यूल्ड थी, तो मेरी प्लानिंग ये थी कि 12 बजे जो वो सेशन था 12 PM पर सीएनएस सम अप वाला जो सेशन था वो हम कर लेंगे, राइट? टिल 3 to 4 PM तक कर लेंगे और उसके बाद हम 5 बजे MCQs कर लेंगे, राइट? बट हमारी क्लास जो है वो 2:30 पर ही पता नहीं बंद हो गई, पता नहीं क्यों बंद हो गई. सो स्टिल आई एम ऑल्सो अमेज्ड व्हाट हैपेंड टू हिम, मतलब कि लैपटॉप. सो MCQ सेशन हम आज अभी कैरी ऑन करेंगे 5 PM पर एंड वी विल बी डूइंग अराउंड 100 MCQs इन दिस सेशन, राइट? सो डेली कुछ 100 MCQs करेंगे, राइट? आई एम हैविंग अराउंड 400 MCQs. सो 4 क्लासेस के अंदर वील बी डूइंग MCQs, राइट? नेक्स्ट 4 क्लासेस के अंदर. बट अभी जो 9 PM वाली आज जो क्लास होने वाली है, आई थिंक मोस्ट प्रोबेबली CNS का सम अप सेशन उसमें हो जाएगा. वील बी कंप्लीटिंग आवर CNS टुडे, राइट? So welcome to Unacademy, guys. Welcome back. I am Shiv Virmani, Indian medical student, and I am author as well. I have written a book, PharmacEasy, that's already out. And welcome to Unacademy, guys. Unacademy is the best online learning platform and the best online teaching platform as well. So here you can get the top quality content, the best strategy, and the top level of educators. And if you want to buy the plus subscription, then you can avail the 10% discount by using the code VIRMANI. This is the code. If you want to buy the subscription, then use this code. Even on an iconic subscription it is valid. So even if you don't want to buy the subscription, you can download this app, Unacademy learning app. It's available on Play Store and App Store. And आप यहाँ पर फ्री स्पेशल क्लासेस जो चलती रहती हैं, you can attend those classes. So they are free classes, right? You can ask your query and आपको आपका query solve उसी टाइम हो जाएगी, and it feels like face to face class only, right? And we are having many top level of educators. And plus, and if you want to buy the plus subscription, then you can use the code. And the plus subscription का benefit क्या है? You can attend live classes, you can attend live tests, live quizzes, batch courses, structured schedule. So I am saying about this only. So you can get a structured schedule on which you can rely basically, right? uh, so if you want to buy, then, and you can consider iconic course as well, right? Iconic course is basically the prep ladder is collaborated with Unacademy, or Unacademy is collaborated with prep ladder. So Unacademy के benefit तो होता ही होता है, but prep ladder का भी benefit है. So there is video lectures there. You can get a question bank, rapid revision course, handwritten notes, and you can select iconic as well. So you are having option for 12, 18, 24, and 36 months, right? And use the referral code VIRMANI. And let's move further, guys. Let's start the MCQ session. And I'll be so for each MCQ, I'll be giving you 30 seconds, right? मैं आपको 30 seconds दूंगा हर एक MCQ पर, and let's see क्या replies आते हैं आपके, और कैसा होता है सब कुछ, है ना? Let's see. Uh, yeah. So let's start, guys. This is the first MCQ. So this is from AIMS November 2013. The first MCQ is duration of action of flumazenil is 5 minute, 10 minute, 20 minute or 30 minutes. तो इसका आंसर फटाफट से रिप्लाई कर दो. आई विल बी वेटिंग फॉर यू till 30 seconds, right? Wait a second, let me start the timer. Mm, yeah. Hmm. तो एक आंसर तो आ चुका है हमारे पास, दैट इज डी. And yes, this is the right answer. D is the correct answer, guys. Duration of the action of flumazenil is 30 minutes. So basically, duration of action is 30 to 60 minutes. But यहाँ पर we are basically हमें यहाँ पर 30 minutes सही लग रहा है. So it is the correct answer. Basically, flumazenil का जो duration of action होता है, it is from 30 minutes to 60 minutes. But in between का कोई option it is not showing. So 30 minutes is the correct answer. And let's move to the second question. All are true about Rameltion except, so A option is agonistat MT1 and MT2 receptors is a substrate of CYP1A2, has high addiction liability, approved for the treatment of insomnia. तो दिस इज द रेमेल्टियन हमने बात करी थी. मैं आई होप कि आप सबको याद होगा. तो लेट्स स्टार्ट द 30 seconds. So remeltion increases the melatonin, and thus it induces the sleep. So second, let's see who answer the first. Oh my. हाँ. तो गाइस आंसर अभी तक नहीं आया है. Yeah, now it's, yeah, C. So guys, Remeltion is agonist MT1 and MT2 receptors. Remeltion is a substrate of CYP1A2. Remeltion is approved for the treatment of insomnia as well. It is also prescribed in the jet lags, right, and shift workers basically. So Remeltion is indicated in various things, right? Jet lags, uh, shift workers, and in insomnias. So the C option है, that is exception, and thus this is the correct option, right? Let's move to the third MCQ. All of the following statements about flumazenil are true except, so first option is it is specific antagonist of benzodiazepines. It may be used to treat barbiturate poisoning. It is given intravenously. It acts on the same site on the GABA channel where benzodiazepines bind. So you are having 30 seconds. So let's see who answers the first. और ये चीज हमने मॉर्निंग वाली क्लास में डिस्कस करी थी. सो होप यू ऑल मस्ट बी नोइंग दिस थिंग. Let's see who answered the first. So guys, in this session we'll be doing around 100 MCQs, and we are having in this PPT we will be having 400 MCQs, around 400 MCQs. So basically we will be doing four sessions, four different sessions, and we'll be completing the MCQs, right? So let's see किसका आंसर आया. हाँ, so B आंसर आ चुका है and B is the correct answer. It may be used to treat barbiturate poisoning. No, this is the wrong option guys. Barbiturate की poisoning को treat करने के लिए first of all what you have to do is ABC maintain करो, gastric lavage करो 2 hours earlier अगर patient आ गया तो, within 2 hours आ गया तो gastric lavage, and after that uh, NaHCO3 administration करो, right? So for the alkalization of the urine, and after that if ये सब ट्रीटमेंट फेल हो गए then you have to do hemodialysis. तो आपको डायलिसिस से ही बारबिचरेट्स जो ब्लड में है वो निकालने पड़ेंगे, राइट? सो अल्टीमेट ट्रीटमेंट इज हीमोडायलिसिस, एंड फ्लूमाजेनिल इज द एंटीडोट फॉर benzodiazepines and Z drugs, right? Zolpidem, Zaleplon, Azopiclon. तो उन सारी ड्रग्स के का भी एंटीडोट इज फ्लूमाजेनिन ओनली. So first option is correct. It is the specific antagonist of the benzodiazepines. It is given intravenously. It acts on the same site on the GABA channel where benzodiazepines bind. Yes, हमने देखा था कि अल्फा गामा इंटरफेस पर benzodiazepines bind करते हैं, and at that position only, at that receptor only, benzodiazepines act, फ्लूमाजेनिल भी वहीं से एक्ट करता है और DMCM भी वहीं से एक्ट करता है. तो अगर मैं स्ट्रक्चर बनाऊं तो स्ट्रक्चर कुछ ऐसा था, राइट? So this is beta, this is alpha, this is gamma, this is alpha, this is again beta. So alpha gamma interface पर there was benzodiazepine receptor, flumazenil receptor and DMCM. So एक ही receptor है जिस पर ये तीन चीजें act करती हैं. And here on the alpha beta interface we are having barbiturate receptor, and here on the beta thing we are having the GABA receptor, right? So we have done the three MCQs, and कैमरा लैग, फिर से लैग स्टार्ट हो गया. ओ माय गॉड, ओ माय गॉड, आई डोंट नो व्हाट्स रॉन्ग विद द दिस लैपटॉप. फोर्थ एमसीक्यू पे चलते हैं. विच ऑफ द फॉलोइंग कंपाउंड एक्ट एज बेंजोडाइजेपिन एंटागोनिस्ट? विच ऑफ द फॉलोइंग कंपाउंड्स एक्ट एज बेंजोडाइजेपिन एंटागोनिस्ट? So A option is flumazenil, naloxone, furazolidine and naltrexone. So these are the four choices. And फटाफट से बताओ, 30 सेकेंड स्टार्ट हो चुके हैं. And let's see who answered the first. Oh, I think now there is no lag anything. या आंसर आ चुका है गाइस, आंसर आ चुका है. And 30 seconds are over now. So let's discuss what is the correct answer. It is basically very easy question. Which of the following compound acts as benzodiazepine antagonist? Everyone knows flumazenil, right? So let's get started with the fifth question. The effect of the thiopenton on the CNS is quickly terminated because of rapid metabolism in CNS, quick first pass metabolism, redistribution, rapid metabolism in systemic circulation. So 30 seconds starts now, and what is the correct answer? Hmm, आंसर आ चुका है. but 30 seconds are still not over. Yeah, now 30 seconds are over and आंसर आ चुका है. आंसर आया है C and yes, you guys are right. Redistribution. So the effect of thiopenton on the CNS is quickly terminated because of redistribution. Right. So sixth MCQ आता है. All of the following benzodiazepine can also be used in elderly, those with liver disease, except lorazepam, oxazepam, triazolam, and diazepam. All of the benzodiazepines can be used in elderly and those with the liver disease, except lorazepam, oxazepam, triazolam, and diazepam. So what's the answer? What's the answer? What's the answer? Let's see who answered the first. Hmm. I think 30 seconds are over now and still no answer is there. So guys, 30 seconds are over now and the correct answer is diazepam. Diazepam is the correct answer. All of the following benzodiazepine can be used in the elderly and those with liver disease except diazepam. Diazepam is not used. Basically, these three drugs are short acting, right? Diazepam nahi hai, that's why it cannot be used. Seventh आता है inverse agonist of the benzodiazepine receptor is phenobarbital, flumazenil, beta carbolin and gabapentin. तो क्या है इसका आंसर? phenobarbital, flumazenil, beta carbolin, gabapentin. इनवर्स एगोनिस्ट की बात हो रही है, एंटागोनिस्ट की बात नहीं हो रही. सो ध्यान से आंसर देना प्लीज. इनवर्स एगोनिस्ट की बात हो रही है. यहाँ पर हम एंटागोनिस्ट की बात नहीं कर रहे. तो and your 30 seconds starts now. Let's see who answers first. आंसर हमारे पास आ चुके हैं बट 30 सेकेंड्स अभी तक पूरे नहीं हुए हैं. तो we'll be waiting. Yeah. So 30 seconds are over and answer आ चुका है C. That is correct. Beta carbolin is the correct answer, guys. Beta carbolin is the correct answer. C. Inverse agonist of the benzodiazepine receptor is C. Beta carbolin. Right. Gabapentin acts on the beta interface, पर flumazenil acts on the as antagonist on the benzodiazepine receptor. एंड phenobarbital तो यहाँ एक्ट ही नहीं करता, ये अपना अल्फा बीटा इंटरफेस पर ही एक्ट करता है. राइट. गाबापेंटिन बीटा इंटरफेस पर करता है, phenobarbital अल्फा बीटा इंटरफेस पर करता है, फ्लूमाजेनिल और बीटा कार्बोलिन अल्फा गामा इंटरफेस पर करते हैं. But antagonist is flumazenil and inverse agonist is beta carbolin. Let's move further. Eighth question is, which of the following agents bind to GABA receptor chloride channel complex? Which of the following agents bind to GABA receptor chloride channel complex? First is ethanol, alpha xylon, zolpidem, and buspirone. So which is the drug? Uh, right. 30 seconds starts now. Let's see who answers the first. So it's asking that following ड्रग जो कि गाबा रिसेप्टर क्लोराइड चैनल कॉम्प्लेक्स से बाइंड करती है. इट्स आस्किंग, मतलब बहुत ही इजी है एंड 30 सेकेंड्स आर ओवर नाउ एंड आंसर हमारे पास सिर्फ दो आए हैं आई थिंक. एंड जो दो आए हैं वो भी करेक्ट है, सी। यस, यू गाइस आर करेक्ट, zolpidem they acts through the गाबा रिसेप्टर क्लोराइड चैनल पर एक्ट करते हैं, बट गाबा रिसेप्टर क्लोराइड चैनल पर भी बेंजोडाइजेपिन रिसेप्टर पर एक्ट करते हैं, बेंजोडाइजेपिन रिसेप्टर पर एक्ट करते हैं कहाँ पर, अल्फा गामा इंटरफेस पर। And ninth question is, in which of the following disorder administration of barbiturates is contraindicated? Right, contraindicated. Anxiety disorder, acute intermittent porphyria, kernicterus, refractory status epilepticus. So you are having four options: anxiety disorder, acute intermittent porphyria, kernicterus, refractory status epilepticus. So in which barbiturates are contraindicated? फटाफट से बताओ, 30 seconds starts now. And what is your answer? आंसर आ चुका है, and I think you guys are right. Yes. So you guys are right, guys, and answer is B, acute intermittent porphyria. Oh my god, phone गिरने वाला था. So B answer is B, acute intermittent porphyria. Barbiturates are contraindicated in acute intermittent porphyria. And 10th question is, which of the following agents do not act via GABA chloride channel complex receptors? Zopiclone, benzodiazepine, thiopentone, promethazine. So, which is the correct answer, guys? Which is the correct answer? So, 30 seconds starts now. 30 seconds starts now. Let's see who answered the first. Mhm. Which of the following agent do not act via GABA chloride channel receptor? So, guys, third basically आंसर आया है डी, एंड यस, डी इज करेक्ट. 10th क्वेश्चन का डी इज करेक्ट, प्रोमिथाजिन. It do not act via GABA mediated chloride channel. Drugs that can be used safely in porphyria are phenobarbital, ketamine, sodium valproate, midazolam, and pethidine. So this is a PGI question, so more than two options are correct. So phenobarbital, ketamine, sodium valproate, midazolam, and pethidine. In which of these drugs they are safe in porphyria? Which of these drugs are safe in porphyria? हाँ, so 30 seconds में से 15 seconds are already over. We are having 10 seconds more, guys. So last 3 seconds are there. So guys, जो correct answer है that is midazolam and pethidine. Midazolam and pethidine, these two drugs can be used safely in porphyria, right? Phenobarbital, ketamine, and sodium valproate, these cannot be used, right? So D and D are correct. And किसने आंसर दिया है करेक्ट? टेक नंबर एस ने. तो टेक नंबर एस कौन है? आपने नाम नहीं लिखा हुआ, बट यू आर राइट. एंड 12th क्वेश्चन करते हैं. So which of the following statements are true regarding benzodiazepines? First is, it acts as a GABA agonist. Diazepam is a short acting benzodiazepine. Diazepam causes lesser respiratory depression than midazolam. Nitrazepam is metabolized in liver. Diazepam has higher abuse potential than midazolam. तो कौन सा ऑप्शन इज करेक्ट एंड इसमें भी मोर देन वन ऑप्शन इज करेक्ट हो सकता है पीजीआई का पेपर है बिकॉज सो 30 सेकेंड स्टार्ट्स नाउ एंड इज द करेक्ट आंसर 5 seconds are left. या वाइल्प्रोइट के काफी सारे इंटरेक्शंस होते हैं यार गाइस So guys, 30 seconds are over and 12th ka correct option is first of all nitrazepam is metabolized in liver. So this is correct. And the second option that is correct is uh, diazepam causes lesser respiratory depression than midazolam. So C and D are correct. So first A की बात करते हैं. It acts as GABA agonist. So it does not act as GABA agonist. It is GABA facilitatory. GABA mimetic नहीं है. So GABA facilitatory है ये, right? And after that, diazepam is short-acting benzodiazepines. No. Diazepam has higher abuse potential. No. Right. So बहुत ही कम addiction cause कर सकता है diazepam. So C and D are correct. These two are correct. And on moving further, which of the following drugs is an antagonist to diazepam? Phenagram, flumazenil, domperidone, bromocriptine, naloxone. ये तो आपको पता ही है आई होप तो 30 सेकेंड्स का टाइमर स्टार्ट हो चुका है एंड फटाफट से आंसर करो सो आई सेकेंड तो फाइनली 30 सेकेंड्स का टाइमर इज ओवर एंड एंड स्टिल आई कैन सी ओनली वन आंसर या सो बी आ चुका है एंड इसके अंदर तो सच कुछ था नहीं बी इज द करेक्ट आंसर फ्लूमाजेनिल एंड 14th पर आते हैं सो in serine poisoning conversions occur because of the antagonist effects at the receptor for aspartate glycine GABA and glutamate which is correct guys which option is correct फटाफट से option पे टिक करो so we are having 30 seconds let's see कौन सा correct होता है सो आंसर 30 seconds are over now and आंसर आ चुका है हमारे पास that is B and that is glycine yes glycine is the correct option in nutrition poisoning conversions occur because of the antagonist effect at the receptors for glycine which of the following statements regarding barbiturates is accurate barbiturates is accurate so a benzodiazepine exhibit a steeper dose response relationship as compared to barbiturates and barbiturates may increase the half-lives of the drug metabolized by the liver. Alkalinization of the urine will accelerate the elimination of the phenobarbital and respiratory depression caused by the barbiturate overdosage can be reversed by the flumazenil. So, which option is correct? 30 seconds का timer start हो चुका है and फटाफट से बताओ. It's basically बताओ 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 बताओ, मैंने कुछ भी हिंट नहीं डिस्क्लोज करूँ। लेट्स सी आंसर्स द फर्स्ट। या सो क्या है इसका करेक्ट आंसर? सो सी आया है, एंड सी इज द करेक्ट आंसर। अल्कलाइनाइजेशन ऑफ द यूरिन विल एक्सेलरेट द एलिमिनेशन ऑफ द phenobarbital। यस, तो हमने ये बात करी थी अभी ऊपर कि इफ acute barbiturate poisoning क्या का ट्रीटमेंट क्या होता है? मेंटेन एबीसी, गैस्ट्रिक लवाश एंड alkalization of urine, और administration of the sodium bicarbonate and मैनिटोल 20%। और इससे भी अगर ट्रीटमेंट ना हो, देन द अल्टीमेट ट्रीटमेंट इज हीमोडायलिसिस। So alkalinization of the urine will accelerate the elimination of phenobarbital. This is the most correct option. Respiratory depression by overdosage is reversed by no. This is wrong. Flumazenil is antidote for benzodiazepines and Z drugs. Right. Barbiturates का पे कोई एक्शन नहीं होता. Barbiturates में increase the half life of the drug metabolize no, and decrease करती है basically ये अपना भी बेसिकली दे आर एंजाइम इंड्यूसर्स, और ये अपना भी मेटाबोलाइजेशन इंक्रीज करते हैं और साथ वाली ड्रग का भी मेटाबोलाइजेशन इंक्रीज करते हैं, राइट। बेंजोडाइजेपिन exhibit a steeper dose response relationship as compared to barbiturates. Now बेंजोडाइजेपिन्स की फ्लैटर डोज रिस्पॉन्स रिलेशनशिप होती है एज कम्पेयर टू बारबिचुरेट्स। बारबिचुरेट्स की स्टीपर होती है। 16 पर आते हैं, विच ऑफ द फॉलोइंग स्टेटमेंट बेस्ट डिस्क्राइब्स द मैकेनिज्म ऑफ एक्शन ऑफ बेंजोडाइजेपिन? First of all, is benzodiazepine activate GABA receptors in the spinal cord. Benzodiazepine block glutamate receptor in neuronal pathways in the brain. They increase the frequency of opening of the chloride ion channel that are coupled to the GABA receptors. They are direct acting GABA receptor agonist in the CNS. So, 30 seconds start होते हैं अब, and फटाफट से आंसर बताओ। So what should be the correct answer, guys? What should be the correct answer? So finally 30 seconds का time is over, and we are having so there are two correct option, yeah. So दो लोगों ने सही आंसर करा है, and correct answer is C. They increase the frequency of the opening of the chloride channels that are coupled to the GABA A receptors, right? So this is the correct option. Right, let's move further. 17th, flumazenil can reverse the respiratory depression caused by which of the following? Fentanyl, ketamine, midazolam, and propofol, which should be the correct option, guys. So 30 seconds starts now, and फटाफट से reply कर दो. So 30 seconds are over, guys, but yeah, आंसर भी आ चुके हैं। सी देखो, अब फ्लूमाजेनिल इज एंटीडोट फॉर बेंजोडाइजेपिन। सो इसके अंदर बेंजोडाइजेपिन का ग्रुप में मिडाजोलाम इज ओनली द ड्रग, सो मिडाजोलाम सी शुड बी करेक्ट, राइट। आई होप इट्स ओके। एंड 18th पर चलते हैं। इंक्रीज टेंडेंसी टू फॉल asleep at night without causing CNS depression is a property exhibited by pyridoxine, diphenhydramine, melatonin, and ethanol. So what should be correct, guys? Increased tendency to fall asleep at night without causing CNS depression is a property exhibited by pyridoxine, diphenhydramine, melatonin, and ethanol. So इसमें से correct option क्या होना चाहिए? 30 seconds. Charge now. So yeah, so आंसर आ चुका है and we are still having 5 seconds. Uh, yeah, so आंसर आ चुका है and yes, you guys are right. So melatonin is the substance जो कि बिना CNS depression से it can induce sleep, right? Melatonin. And the drug is Ramelteon. Ramelteon can increase the melatonin, right? Which of the following hypnotic drug facilitate the inhibitory action of GABA but lacks anticonvulsant or muscle relaxant property and has minimal effect on the sleep architecture? Buspirone, diazepam, phenobarbital, and zaleplon. So, guys, 30 seconds are start now, and फटाफट से बताओ which option should be correct. So, we are having 3 seconds left. Yeah. So three. So time is over, and correct option is Zaleplon. Yes, Zaleplon is the drug, right? It comes under the Z drug or non-benzodiazepine drug, right? But its antidote is flumazenine only. This is the drug that basically disco that that is having minimal effect on the sleep architecture, and it lacks the anticonvulsant and muscle relaxant property as well. 20th पे आते हैं. A very potent short acting benzodiazepine was given to a patient Kallu for the purpose of causing hypnosis, but the drug caused psychiatric disturbance in him. Which of the following can be a hypnotic drug used? So very potent drug plus short acting दी थी, right? So potent और short acting benzodiazepine कौन सी है इनमें से? Your 30 seconds starts now, and let's see कौन सबसे पहले आंसर करता है. Hmm. सो इसके अंदर आपको ये कीवर्ड्स याद करने हैं कि वेरी पोटेंट शॉर्ट एक्टिंग बेंजोडाइजेपिन कौन सी होनी चाहिए. तो टाइम इज ओवर गाइस, टाइम इज ओवर एंड वी आर हैविंग आंसर्स and D is the correct answer. Triazolam, it is a benzodiazepine that is very potent and very short acting as well, right? So this is the drug triazolam. And let's go to the 21st question. A 40-year-old male patient with liver dysfunction is scheduled for a surgical procedure. Lorazepam can be used for pre-anesthetic medication in this patient without concern for excessive CNS depression because the drug is selective anxiolytic like buspirone, um, conjugated directly, reversible by administration of naloxone, forming several anti-active metabolites. So, a 40-year-old male patient with liver dysfunction is scheduled for a surgical procedure. Lorazepam can be used for pre-anesthetic medication, right, in this patient without concern for excessive CNS depression because the drug is कौन सा सबसे अच्छा कीवर्ड आपको लग रहा है? सो या 30 seconds स्टार्ट नाउ एंड लेट्स सी कौन सा आंसर इसका आंसर सही आता है. So your time is over, 30 seconds are over and let's see. So तीन लोगों ने आंसर करा है एंड दो का सही है बी, कॉन्जुगेटेड डायरेक्टली, यस, ग्लूक्रोनाइड कॉन्जुगेशन करके ये मेटाबोलाइट हो जाता, मेटाबोलाइज होकर एक्सक्रीट हो जाता है, राइट. लोराजिपैम, लोराजिपैम एंड ऑक्साजिपैम, सो दीज आर द टू ड्रग्स जो कि ग्लूक्रोनाइड कॉन्जुगेशन करके एक्सक्रीट हो जाते हैं, राइट. And now comes the 22nd question. Which of the following drug is contraindicated in acute intermittent porphyria? Thiopenton, midazolam, propofol and etomidate. तो ये चीज आपको ध्यान रखनी है कि acute intermittent porphyria में कौन से drugs जो हैं that are contraindicated. So your 30 seconds starts now. मैं भूल गया था. Uh, so answer is A, and you have answered, and you guys are right. Thiopenton is a barbiturate, and it is absolutely contraindicated in the acute intermittent porphyria. And now let's go to the 23rd question. Action of flumazenil on benzodiazepine receptor is agonist, partial agonist, inverse agonist, or antagonist. Agonist, partial agonist, inverse agonist, or antagonist. So, what should be the correct answer? Your 30 seconds starts now, and what should be the correct answer? Uh, let's see. Let's. So answer is, इसके अंदर वैसे कुछ ज्यादा था नहीं इस क्वेश्चन में. So answer is D, and you all guys are correct. Antagonist, flumazenil is antagonist, right? Both barbiturate and salicylate are maximally absorbed in stomach because they are weakly basic and so ionized in the stomach. They are highly basic, so less ionized in stomach. They are weakly acidic, so do not ionize in stomach. They are highly acidic, so highly ionized in stomach. इसके अंदर दिमाग लगा के करना. I am giving you 50 seconds, right? I am giving you 50 seconds for this, and फटाफट से इसका आंसर डिस्कस करते हैं. इसके अंदर दिमाग से करना गाइस, थोड़ा सा है, मतलब ज्यादा कॉम्प्लिकेटेड नहीं है, इजी है. या, तीन आंसर्स आ चुके हैं, एंड आई होप दैट यू आर राइट. 10 seconds are still left. 3, 2, 1, and you guys are right. C is the correct option. So देखो, अगर barbiturates and salicylates they are acidic, right? ये तो आपको पता ही है, they are acidic. बट अब वीकली एसिडिक या हाईली एसिडिक, इसका अगर आपको पता करना है, सो सीधा आपको यहाँ दिख रहा है डू नॉट आयोनाइज इन द स्टमक. सो एंड इट्स आस्किंग द सेम थिंग, मैक्सिमली अब्सॉर्ब्ड इन द स्टमक. फॉर एब्जॉर्प्शन यू नीड नॉन आयोनाइज स्टेट, non-ionized state, right? And अगर वो highly ionized हो गया, then it would not be absorbed. It cannot cross the membranes, right? वो membranes cross नहीं कर पाएगा and the small intestine में चला जाएगा अगर highly ionized है. So we need non-ionized drug here that can easily transmitted through the or can pass through the lipoidal membranes. So we want a lipid soluble drug और lipid soluble drug का मतलब non-ionized state. Acid plus acid, non-ionized lipid soluble can easily cross the membranes. And basic plus basic, non-ionized state can easily cross through the membranes. But acid plus base is non-ionizable, is ionized state. Acid plus base is ionized state, so it cannot cross the membranes because it is a water soluble drug, right? And let's move further. So next question is, which of the following drug is not metabolized by the liver? Flunitrazepam, diazepam, oxazepam, nitrazepam. Which of the following drug is not metabolized by the liver? Flunitrazepam, diazepam, oxazepam, nitrazepam. So your 30 seconds starts now. And what should be the correct answer? So 3, 2 and 1 and हमारे पास आंसर आया है हमारे पास आंसर आया है बी डी and B, D, C. So all are different. And guys, C is the correct answer. Which of the following drug is not metabolized by liver? So oxazepam is the drug. देखो oxazepam and lorazepam. These two drugs are there जो कि liver से metabolize नहीं होती, right? और they can be given during the hepatotoxicity as well. कहीं पर भी अगर क्वेश्चन आए कि हेपेटोटॉक्सिसिटी में कौन सी ड्रग दोगे अभी हमने पीछे भी करा था सो लोराज़ेपम वाज द आंसर ऑफ दैट एमसीक्यू और वहीं पर मैंने लोराज़ेपम और ऑक्साज़ेपम दोनों के नाम लिया था सो लोराज़ेपम एंड ऑक्साज़ेपम दीज टू ड्रग्स आर देयर दैट आर safer in the liver disorder, right? Shortest acting benzodiazepine is shortest acting benzodiazepine is and your 30 seconds starts now. 30 seconds starts now. Uh, 'So guys, um, आंसर आ चुका है A and yeah guys you guys are right shortest acting benzodiazepine is midazolam. Midazolam is the correct answer correct option. Midazolam is the shortest acting benzodiazepine, right? And the drug of choice for relapsing intermittent multiple sclerosis is तो ये चीज हमने डिस्कस नहीं करी दिस इज मेडिसिन पॉइंट ऑफ व्यू बट मेरे पास इसके नोट्स अवेलेबल हैं अगर आप लोगों को चाहिए हो then I can provide those notes, right? I can provide you those notes. So पहले बताओ कि what should be the drug of choice and your 30 seconds starts now. 5, 4, 3, 2, 1. Time is over. and we are having two answers, C and B, right? So the correct answer is B. Interferon beta is the drug of choice, basically, right? Drug of choice for relapsing, remitting multiple sclerosis. So for acute attacks, you will be so देखो, for acute attacks, what you have to do is steroids देने पड़ेंगे, right? And for reducing, basically, ताकि relapse reduce कर सकें, then you have to give INF beta. And natalizumab is the drug that is used for the resistant cases, right? Resistant cases के time natalizumab. Let's see what the next question is. So guys, which is the only drug effective for improving the EDSS in multiple sclerosis? So ये थोड़े से मेडिसिन वाले क्वेश्चंस आ गए, हमने डिस्कस नहीं करे हैं मेडिसिन वाले क्वेश्चंस, बट लेट्स सी कोई आंसर कर पाता है या नहीं. So 28th question is, so your timer starts now. So which are the only drug effective in improving the EDSS in multiple sclerosis? Expanded disability status score in multiple sclerosis. So this is a typical type of MCQ जो कि देखने को मिलता है. So your 30 seconds are over now. एंड आंसर किसका सही आया है? आंसर सिर्फ एक आया है, डी नेटैलिजुमैब. यस, यू गाइस आर राइट. मतलब एक नहीं करा है. सो मल्टीपल स्क्लेरोसिस हम कल पूरा अच्छे से नोट्स मेरे जो है वो डिस्कस कर लेंगे, राइट? मल्टीपल स्क्लेरोसिस का अच्छे से मेडिसिन वाले नोट्स हैं वो अच्छे से डिस्कस कर लेंगे, राइट? एंड वहां पर हम अच्छे से पढ़ लेंगे कि क्या होता है मल्टीपल स्क्लेरोसिस और क्या क्या ट्रीटमेंट हम दे सकते हैं, राइट? एंड 29th क्वेश्चन इज विच ऑफ द फॉलोइंग ड्रग इज नॉट यूज्ड इन मल्टीपल स्क्लेरोसिस. ये भी हम कल ही देखेंगे. So which of the following drug is used as the transcranial patch for Parkinson's disease? This is important. Which of the following drug is used as transcranial patch for Parkinson's disease? So what should be the drug? So 30 seconds are started. Uh, yeah. 3, 2 and 1. So guys, आंसर भी हमारे पास आ चुका है B. So B is the correct answer. Rotigotin is, it is the correct. Basically, it is indicated for also for the restless leg syndrome, right? Rotigotin is the drug जो transdermal patch is used basically, right? And it is formulated for once a day patch basically. जब आप एक दिन में रात को उतार के सो जाओ फिर अगले दिन लगा दो, तो basically this is a transcranial patch for the Parkinson's disease. And rotigotin is ergot non-ergot derivative. एंड 31st की अगर हम बात करें, विच ऑफ द फॉलोइंग इज कंबाइंड विद द रीवास्टिगमेंट एंड डिक्रीजेस इट्स एफिकेसी. तो रीवास्टिगमेंट के साथ क्या कंबाइन करेंगे जिसकी वजह से उसकी एफिकेसी डिक्रीज हो जाएगी? सो फर्स्ट ऑफ ऑल इज सेलेक्टिव सेरोटोनिन रीअपटेक इनहिबिटर्स, रिवर्सिबल इनहिबिटर ऑफ एमएओए, ट्राइसाइक्लिक एंटी डिप्रेसेंट्स, एटिपिकल एंटी डिप्रेसेंट्स. व्हाट शुड बी द आंसर गाइस? सो अगर आपको नहीं पता, रीवास्टिगमेंट इज भाई ऑफ फाइजोस्टिगमेंट, नियोस्टिगमेंट. So it is a anticholinesterase drug and it is indicated for the Alzheimer's. Alzheimer's के लिए it is indicated, so which is correct? तो 30 seconds starts now. पहले ही कर देने चाहिए थे बट मैं भूल जाता हूँ. 10, 9, 8, 7. So guys, टी आया है हमारे पास आंसर. सीधे एंटीकोलिनर्जिक का. T is tricyclic antidepressants. You guys are right. So C is the correct answer. Right. So they are having strong anticholinergic action. Tricyclic antidepressant. So rivastigmine के साथ अगर tricyclic antidepressant देंगे तो इसकी efficacy decrease हो जाएगी because rivastigmine increases the acetylcholine because it is a anticholinesterase. So जो एंजाइम acetylcholine को खत्म कर रहा था, मेटाबोलाइज कर रहा था, उसको ये ब्लॉक कर देता है. Right. So that's why acetylcholine बढ़ जाता है, but tricyclic antidepressants at the same time they are having strong anticholinergic property. So that's why. And the 32nd is all of the following statement about try and time use of Wilson's disease is true except it is more potent than penicillamine. It is used as an alternative to penicillamine in non-tolerant patients. It should not be administered within 2 hours of iron supplementation. It can cause iron deficiency anemia, which is reversible by oral iron supplements. So it is more potent than penicillamine. It is used as an alternative to penicillamine in non-tolerant patients. It should not be administered within 2 hours of iron supplementation. It can cause iron deficiency anemia, which is reversible by oral iron supplements. So your 30 seconds starts now. And what should be the correct answer? Wait a second. So guys, 30 seconds are over. And आंसर हमारे पास आया है ए. एंड यस, यू आर राइट, इट इज मोर पोटेंट देन पेनिसिलामीन. राइट, पेनिसिलामीन से ज्यादा पोटेंट बेसिकली ट्राई एंड ट्री. देखो देखो, एक्सेप्शन है. सो पेनिसिलामीन इज मोस्ट पोटेंट चिलेटिंग एजेंट. सो विल्सन डिजीज के अंदर वी वांट चिलेटिंग एजेंट. विल्सन डिजीज का कब होती है? व्हेन देयर आर मोर ऑफ Uh, wait a second. Ha. What's wrong with this? So Wilson's disease कब होती है? When there is increased copper in the body, right? So you want a chelating agent, and penicillamine is a really good chelating agent, most potent chelating agent, and tryptophan उससे कम है. So this is A option is correct, right? It is more potent than penicillamine, no, right? So ये सारे correct हैं. It is used as alternative to penicillin in non-tolerant patient. It should be not be administered within 2 hours of iron supplementation. It can cause iron deficiency anemia, which is reversible by oral iron supplementation. Right? Which of the following agents enhances the bioavailability of levodopa in patients with Parkinson's disease? So which of the following agents enhances the bioavailability of levodopa in patients with Parkinson's disease? So first option is amantadine, ropinirole, entacapone, and silaginol. So what should be the correct answer? So your 30 seconds starts now. So 30 seconds are over now, and we are having answers C, yes. And which of the following agent enhances the availability of levodopa in patients with Parkinson's disease? C is the correct answer, entacapone. Right, entacapone is the correct answer. Right. Next question is, all of the following statements regarding levodopa are correct except in Parkinson's, phenothiazide reduces its efficacy. It's a prodrug. Pyridoxine reduces effect of levodopa in Parkinsonism, and domperidone blocks levodopa, induces MSS and its therapeutic potential. So what should be the basically it's asking that what is the exception, right? So क्या होना चाहिए? Your 30 seconds starts now, and let's see. 4, 3, 2, and 1. Right. तो आंसर हमारे पास एक ही आया है, दैट इज डी. Domperidone blocks levodopa induced emesis and its therapeutic potential. Yes, this is right. So basically, what is asking? So in Parkinsonism, phenothiazides reduce its efficacy. Yes, this is right. And levodopa is a prodrug. Yes, this is also true. Pyridoxine, that is vitamin B6, reduces the effect of levodopa in Parkinsonism. या सो लीवोडोपा का इफेक्ट पार्किंसंस में डिक्रीज करता है, सीएनएस के पास नहीं जा पाता, पेरिफेरल इफेक्ट ही शो होता है, पेरिफेरल साइड इफेक्ट शो होता है. That is also true. So domperidone blocks the levodopa induced MSS at its therapeutic potential now. So this should be correct, right? And let's move further. So, next is 35th question. A patient of Parkinsonism is managed with levodopa. If vitamin B complex is administered concurrently to the patient, the action of levodopa in the brain will be potentiated. Decarboxylation of levodopa in brain will be decreased. Side effect will be ameliorated. Decreased efficacy will result. So, your 30 seconds starts now. And यही चीज मैंने अभी बताई थी. So, what should be the correct answer? So, your 30 seconds starts now. So your 30 seconds are over now, but अभी तक किसी का आंसर नहीं दिख रहा मुझे. I don't know why. तो आंसर आया है डी. एंड यस, डिक्रीज एफिकेसी विल रिजल्ट. यस, एफिकेसी वुड बी डिक्रीज, जैसे कि अभी मैंने कहा कि विटामिन बी सिक्स पायरिडॉक्सिन, if it met the levodopa, what will happen here is ये इन इसको पेरिफेरली डीकार्बोक्सिलेज कर देगा एंड पेरिफेरल सिम्टम्स प्रोड्यूस करेगा, साइड इफेक्ट्स बढ़ाएगा, एमेलियोरेट नहीं करेगा, इंक्रीज करेगा, सीवियर हो जाएंगे. डीकार्बोक्सिलेशन ऑफ लिवोडोपाइन ब्रेन विल बी डिक्रीज नाउ, पेरिफेरली विल बी इंक्रीज होना चाहिए था. द एक्शन ऑफ लिवोडोपाइन द ब्रेन विल पोटेंशिएटेड नाउ. So this should be the, so इसका आंसर D is perfectly fine, perfectly good. Propinerol is the most useful drug for the treatment of Parkinson's disease, Wilson's disease, Hoffman syndrome, and carpal tunnel syndrome. So, propinerol is the most useful treatment of Parkinson's, Wilson, Hoffman syndrome, or carpal tunnel syndrome. So, what should be the answer? I am giving you 30 seconds. Uh, सो अभी तक आंसर नहीं आया है। So guys, answer आ चुका है A and time is also over. So Ropinirole is the most useful in treatment of Parkinson's disease. Yes, you are right. And 37th पे आते हैं. So which of the following statement is false regarding drugs used in the treatment of Parkinsonism? So which of the following statement is false regarding the drugs used in the treatment of Parkinsonism? Amantadine causes ankle edema. Levodopa is effective in reducing tremors. Amantadine is more effective than levodopa. Anti-muscarinic agents are effective in drug-induced Parkinson. So amantadine causes ankle edema. Levodopa is effective in reducing tremors. Amantadine is more effective than levodopa. Anti-muscarinic agents are effective in drug-induced Parkinson. So which of the following is false regarding the treatment of Parkinsonism? We are having 30 seconds and फटाफट से बताओ. आई थिंक बहुत ही इजी क्वेश्चन है ये, बट लेट्स सी. So 30 seconds are over and we are having our answers. So C is the correct option, basically false option. So amantadine is more effective than levodopa. No, why? Most effective treatment is levodopa plus carbidopa. So how amantadine can be more effective than levodopa? No, this is wrong. This is false. So that's why this option is correct. Drugs used for the treatment of Parkinson's disease include levodopa, mezendol, bromocriptine, acyclovir, benzalazide. So, what should be the treatment और कौन सी drugs Parkinson's के treatment में आती हैं and more than one option is correct. So फटाफट से answer बताओ. Uh, more than one option will be correct and your time starts now. 3, 2 and 1. So guys, आंसर आ चुका है. टाइमर ओवर हो चुका है. सो 38 का आंसर वुड बी लीवोडोपा, ब्रोमोक्रिप्टिन एंड बेंसिलाजाइड. These are the three drugs that are used for the treatment of Parkinsonism, right? And drugs can cause Parkinsonism include bromocriptine, phenothiazide, haloperidol, amantadine, and carbidopa. इसका आंसर ढंग से देना. Drugs that cause Parkinsonism like symptoms or extrapyramidal symptoms. So कौन सी ड्रग्स हो सकते हैं? ब्रोमोक्रिप्टिन, फिनोथायाजिन, हेलोपेरिडोल, एमेंटाडिन और कार्बिडोपा. कौन सी हो सकती है? फटाफट से बताओ. फटाफट से बताओ. So your 30 seconds are about to over and what should be the drug? 3, 2 and 1. So our 30 seconds are over now and हमारे पास आंसर आ चुका है B and C. So phenothiazine and haloperidol, these two are the antipsychotic drugs. So हमने बात करी थी कि जो भी पार्किंसन ड्रग्स हैं that can cause psychosis and antipsychotic drugs can cause Parkinsonism. right? So these two are antipsychotic drugs and they can cause Parkinsonism or EPS वाले symptoms, dystonia, akathisia, tardive dyskinesia and Parkinson symptoms. 40 की अगर हम बात करें तो entacapone may be useful in patients being treated with levodopa carbidopa combination because it activates COMT, decreases the formation of 3-OMD, inhibits monoamine oxidase type B, inhibit dopamine reuptake. So what should be the correct answer? What should be the correct answer? Your 30 seconds starts now. 5, 4, 3, 2, and 1. And time is over, guys. So let's see किस किसने आंसर करेक्ट करा है. Yes, all are correct. B is the correct answer. Decreases the formation of 3-OMD. Yes. 41 पे आए. Which of the following adverse effects of levodopa is not minimized even after combining it with the carbidopa? So, which of the following adverse effects of levodopa cannot be minimized even after combining it with carbidopa? Involuntary movement, nausea, vomiting, cardiac arrhythmia, on and off effect. So, what should be the answer? So, your 30 seconds starts now. I think time is over now. And what should be the answer? I think still no one has answered. So, guys, इसका answer is A. Which of the following adverse effects of the levodopa is not minimized even after combining it with carbidopa? So A, involuntary movements आते हैं, right? So that cannot be minimized. But nausea, vomiting minimize हो जाता है, cardiac arrhythmia and on and off effect भी minimize हो जाता है. And now let's talk about the 42nd MCQ. Which of the following anti-Parkinsonian drug directly activate dopaminergic D2 receptors in the striatum? So the drugs are pramipexole, entacapone, benzaldehyde, and seleginil. So कौन सी drug है dopaminergic D2 receptor that directly activates the D2 receptor in striatum? So pramipexole, entacapone, benzaldehyde, and seleginil, which is the correct option, guys. So your 30 seconds starts now, and let's see who answers the first. तो टाइमर इज ओवर एंड आंसर हमारे पास आ चुका है ए प्रामीप्रेक्सोल. Yes, you guys are right. Pramipexole is the correct option. And let's move to the 43rd question. So, which of the following statement about donepezil is correct? So, A is it is a topical carbonic anhydrase used in glaucoma. It is a catechol O-methyl transferase inhibitor used in adjuvant in Parkinson's disease. It is cerebroselective anticholinesterase that affords symptomatic improvement in Alzheimer's disease. It is a synthetic cannabinoid with anti-emetic properties. So what should be the correct answer, guys? So your 30 seconds starts now, and let's see who answers the first. तो लेट्स सी किसका आंसर आया है पहले. So we are having three answers C, and yes, C is correct. Donepezil is a cerebroselective anticholinesterase that affords symptomatic improvement in Alzheimer's disease. Right. 44th की अगर हम बात करें, which statement is correct about pramipexole? Activates the brain dopamine receptors, commonly a first-line therapy for Parkinson's disease, not an ergot derivative, all of the above. So, which statement is correct about pramipexole? Activate the brain dopamine receptors, commonly a first-line therapy for Parkinson's disease, and non-ergot derivative, and all of the above. So, pramipexole. So, you are having 30 seconds, and your time starts now. So, time is over, and आंसर हमारे पास आए हैं. आंसर हमारे पास आया है डी, सिर्फ एक का. एंड यस, डी इज करेक्ट आंसर गाइस. नॉन ergot derivative, it is not an ergot derivative, commonly a first line therapy for Parkinson's disease. Yes, but most effective नहीं लिखा हुआ यहाँ पर. Most effective therapy is levodopa plus carbidopa, right? Activates the brain dopamine receptors, right? Pramipexole activates the brain dopamine receptor. Yes, this is correct, this is correct. So basically, all the three are correct, and that's why all of the above is correct. And 45th question is entacapone is an anti-Parkinson drug. It acts by agonism at dopamine receptors, antagonism at dopamine receptors, monoamine oxidase inhibition, catechol O methyl transferase inhibition. So, what should be the correct answer? Let's see. 30 seconds starts now. Yeah, so 30 seconds starts now. Entacapone is the anti-Parkinsonian drugs acts by which of the mechanism? 25, 24. Mm, let's see. इसका आंसर पहले आता है. So we are having no answer for this. Oh, we are having answer for this. And D. Yes, entacapone is the drug that acts through COMT inhibition, right? So D is the correct option. D is the correct option. And 46th पे अगर हम आए तो a compound X decreases the functional activities of several CNS neurotransmitters including dopamine, adrenaline and serotonin. At high doses, it may cause Parkinson's like extrapyramidal symptom dysfunction. Which of the following can be X? So, baclofen, diazepam, ketamine, rizerpine, which can be the drug? So, your time starts now. And let's see कौन आंसर करता है फर्स्ट. So time is over and let's see किसने आंसर करा है and answer आया है D. Yes, D is correct. So guys, reserpine can produce extrapyramidal symptoms like Parkinsonism, tardive dyskinesia, dystonia, akathisia and all of that. 47th पे आते हैं. A patient of Parkinsonism, Mr. Guy, noticed that the therapeutic effect of levodopa decreased when he was given another drug by his physician, but no interaction was seen when he switched over the levodopa carbidopa combination. So the possible drug prescribed by his physician can be metoclopramide, vitamin B complex, chlorpromazine, and isoniazid. इसको सोचो. So I'll giving you 50 seconds for this question and your time starts now. फटाफट से आंसर करो. uh, फटाफट से. Let's see who answers the first. Hmm. Time is over, guys, and we are having a answer B and vitamin B complex. Yes, pyridoxine is the correct answer. Pyridoxine or vitamin B6. तो विटामिन बी सिक्स के साथ ही होता है. क्या होता है? सो बेसिकली व्हाट इज हैपनिंग हियर इज लीवोडोपा के साथ अगर दे दो then or pyridoxine. Vitamin B6 is also called as pyridoxine. So what will happen is, so levodopa decarboxylation increase हो जाएगा levodopa का and thus more levodopa would be converted to dopamine peripherally, right? So peripheral side effects would be produced. So dopamine जाएगा alpha 1 beta 1 and D1 and CTZ को स्टिमुलेट करेगा. अल्फा 1 की वजह से हाइपरटेंशन क्राइसिस आ सकता है, बीटा 1 की वजह से एरिथमिया हो सकता है, D1 की वजह से पोस्चरल हाइपोटेंशन हो सकती है एंड CTZ की वजह से nausea and vomiting can occur, right? So pyridoxine or vitamin B complex should be should not be given or should not be combined with levodopa, right? So now comes 48th question. Which of the following drugs should not be given along with the levodopa? A is carbidopa, MAO inhibitors, vitamin B complex, and benzerazide. So which of the following drugs should not be given along with the levodopa? A option is carbidopa, MAO inhibitors, vitamin B complex, and benzerazide. So which of the following drugs should not be given along with the levodopa? Uh, so let's see. किसका आंसर पहले आता है. Your time starts now and let's see who answers the first. So let's see किसका आंसर आता है. So answer is C. You all must be knowing this though. So vitamin B complex के साथ लीवोडोपा नहीं देना चाहिए. जैसे कि हमने अभी पिछले क्वेश्चन में डिस्कस करा है, सो वो दोबारा से मैं डिस्कस नहीं करने वाला. And drug of choice in the drug induced Parkinsonism is levodopa, benzhexol, amantadine, carbidopa. So drug of choice is a so the drug of choice in drug induced Parkinsonism, right? So what should be the correct option? Your time starts now and let's see. So 5, 4, 3, 2, and 1. Yeah, so we are having the answer, and the answer is B, benzexol. Yes, guys, drug-induced Parkinsonism के अंदर we'll be providing the anticholinergics, right? Anticholinergics, and anticholinergics के अंदर benzexol is the correct answer, right? But most effective अगर drug आए then levodopa plus carbidopa is the answer most effective के लिए. But drug-induced Parkinsonism के लिए drug of choice is benzexol. Right. So 50th पे आते हैं. Which of the following abolishes the therapeutic effect of levodopa? Which of the following abolishes the therapeutic effect of levodopa? Thiamine, carbidopa, pyridoxine, and benziracide. So your time starts now, and your time starts now. Let's see. इसका आंसर आता है. So time is over, and C is the correct answer. Which of the following abolishes the therapeutic of levodopa? Pyridoxine or vitamin B6? विटामिन बी सिक्स के अगर लीवोडोपा के साथ दी देन कार्बोक्सिलेशन बहुत ही ज़्यादा बढ़ जाती है, एंड सारा का सारा लीवोडोपा पेरिफेरली डोपामिन में कन्वर्ट हो जाता है, एंड सिम्टम्स प्रोड्यूस हो जाते हैं, राइट. इट्स एज सिंपल एज दैट. Which one of the following drug is used in the Alzheimer disease? Tacrine, Pamoline, Doxapram, and methylphenidate. तो कौन सा है? So what should be the correct answer? Uh, what is बेकार इसके अंदर? What is बेकार? निरुपम सिंह is saying बेकार. So guys, let's move to the another question. Which drug is not used in Alzheimer disease? So you are having how to pass without study? No, without studying you cannot pass. बिना पढ़े कैसे पास हो सकता है कोई भी? Memantine, galantamine, ropinirole, donepezil. So these are the 4 drugs. So कौन सी ड्रग Alzheimer's के अंदर यूज नहीं होती? So your time starts now, and let's see किसका आंसर फर्स्ट आता है. Let's see किसका आंसर फर्स्ट आता है, and I don't know what's wrong with my colleague. I don't know why he's playing question. वो क्या बोलते हैं म्यूजिक. हाँ, so 50 सेकेंड की बात करते हैं. 50 सेकेंड की बात करते हैं, and tomorrow is my exam. Oh my god. So how to pass without study, how to pass without study, how to pass without study. Tomorrow is my exam. अरे बिना पढ़े you cannot score. Please try to understand. Tomorrow is your exam, but कितना सिलेबस कवर हो गया अराउंड 60% अगर सिलेबस कवर होगा देन यू कैन पास बट अगर इससे कम हुआ है देन यू कैन नॉट एंड with the 50-second question I am taking your leave and answer of 51 so we have already discussed ना कि 51 का आंसर was 51 का आंसर हमने डिस्कस करा तो था that was a attack crime so we have already discussed and what is it sir tomorrow is my exam how to study without how to pass without study no if you have completed the 60% syllabus then only you can pass otherwise I am sorry I am I cannot do anything for you आज रात को पूरा अच्छे से पढ़ लो एंड विद दिस आई एम टेकिंग योर लीव टिल 52nd क्वेश्चन हमने कर लिया है 53rd से हम कल से पढ़ेंगे 53rd क्वेश्चन राइट तो बट टुडे 9 p.m. we are having sum up session 2 right sum up session 2 right आज रात से पढ़ना शुरू करो हाँ जितना हो जाए उतना सही है बाकी देखो लेट्स सी so guys I am taking your leave and we will 9 p.m. जो हमारा बच गया था 5 बजे वाली 12 बजे वाली क्लास में we will be completing that thing so sum up 2 so that is called as sum up 2 and thank you so much guys thank you so much for coming thank you so much for answering thank you so much for coming and do like the video सब्सक्राइब भी कर लो चैनल को इफ यू हैव नॉट सब्सक्राइब्ड एंड डू कमेंट आल्सो गाइस क्या लगा आपको अच्छा लगा एंड इफ यू वांट टू बाय द प्लस सब्सक्रिप्शन और इफ यू वांट टू बाय द आइकॉनिक सब्सक्रिप्शन देन यू कैन यूज द कोड VIRMA